Hello, my name is Gregory Jono. I'm a nurse anesthesia doctorate student at FIU. I grew up in New York City and lived there until just recently. Last year, I moved to South Florida for my program. This allowed me the unique opportunity to grow up around and learn of several different ethnicities, nationalities, and backgrounds. Unfortunately, though, that allowed me the opportunity to see several of my surrounding neighborhoods suffer the injustices of being an underserved community. This is a big reason of why I plan to and aspire to become a healthcare professional, provider, and get involved in policy change and implementation. Growing up in this environment also allowed me to develop the personality traits and skills such as becoming understanding and empathetic, understanding that everyone has their own story, background, and things that they're dealing with. Also, I complement this empathetic approach with a calmness that allows me to consider various different viewpoints on an issue or topic prior to jumping to a conclusion. This helped me become very successful in the intense clinical environment of the ICU, where patients' outcomes and possibly patient lives depended upon my decision-making in a moment. Also, I have over a decade of experience working in healthcare clinically in various different roles. This experience can become invaluable as I enter the possibility of becoming involved in policy, political arena, or continuing to grow in my clinical professional career. I continue to enhance and develop these strengths through challenging myself clinically, professionally, and personally, as several of these traits that I mentioned can only be fine-tuned and developed through experience and personal development. To prepare for a DC internship opportunity, I plan to remain well-read on several different healthcare policy issues, especially those related to healthcare. Self-education in this type of field is crucial, and it's the only way to continue to be involved and have a voice of change through self-education. Throughout this class, I've enjoyed learning of different aspects of policy reform, and the different branches throughout government that affect these type of policies and policy changes. My favorite module probably was the advocacy and lobbying module, as I got to learn how to actually implement change and go the steps that would be taken to create a voice, create a movement, and create support for a planned change. I truly enjoyed this class. I hope that my colleagues has enjoyed the class as well and took from it things that we can take into our future careers as anesthesia providers, to take a leadership role and really try to change the healthcare disparities that are unfortunately existing within our country. Thank you very much.